So tough act to follow, but setting the bar high for hope here. So good evening. As Hillary mentioned, my name is Resham Patel in the Department of Environmental and Occupational Health Sciences. You're catching me on a day after giving a few other classes and lectures. So those classes are actually 80 minutes long. So I promise this won't be that. I will just mention I'm also happy to serve as the Director of Practitioner Engagement for the new center that Hillary mentioned on disaster resilient communities that launched this fall. I'm going to share a story about recent collaborations between practitioners, researchers, and communities on climate resilience. I'll get to that in a minute, but I did want to point out that this new Center for Disaster Resilient Communities brings together over 100 faculty across various UW schools and colleges with a broad range of expertise working towards disaster resilience. And it builds on a lot of opportunities and areas that people have been partnering on in the past, including when I served as a practitioner with this group. So I'm very excited about where this is heading. Perhaps most exciting for me is that the broad range of faculty coming from a variety of disciplines beyond public health, so engineering, built environment, policy, et cetera, have all kind of come together, voicing their real strong interests in thinking about working with communities, working with practitioners, looking at health and well-being. So as someone who recently came to University of Washington after working at a health department for a decade, I'm really excited about where that leads in terms of CDRC's mission, and I'm super proud that the School of Public Health has been playing such a pivotal role in its formation. But going the other way, I'm going to focus on this story about climate resilience and story about hope and story about empowerment and communities. So what does this type of a partnership between practice, academia, and communities look like, especially as we talk about eco-anxiety, as we talk about climate resilience? This is an example that I'd share that's aimed at building climate resilience, disaster resilience, with locally tailored strategies in Seattle's Duwamish Valley. The SASPR, which is the Seattle Assessment for Public Health Emergency Response, was a collaboration between UW, the Public Health Seattle-King County, Washington Department of Health, City of Seattle, and most importantly, the Duwamish River Community Coalition and Duwamish Valley Youth Corps. So a lot of different organizations and perspectives came together on this project, which I'll share a bit about. In fact, while this project was underway in 2021, 2022, I was working at Public Health Seattle and King County. So I'm going to go ahead and take some time to put my practitioner hat on while I share this story. I pitched the idea, in fact, of using the Center for Disease Control and Prevention's model, so talk about evidence-based strategies, for working on a community disaster needs assessment back in 2019 when I was working for the county. And I wanted to work with the Department of Health, and I wanted to work with leading faculty here at University of Washington on the goal of starting some serious planning on this in January 2020. Best laid plans, right? We get slammed with COVID response. I'm working at a health department in preparedness, so you can guess how much time and where this filled in terms of priorities. So as I was sad that this was now on the back burner, I was really excited that some of my close faculty partners here at the School of Public Health generously stepped in, brought us all back together in 2021, and led the way to this successful endeavor. But what were we trying to accomplish? Well, working in preparedness at a local health department, I was interested in the process of doing a rapid needs assessment to understand what this could look like in the aftermath of a disaster. Other partners were interested in specific health data to inform public health programming. Others, the process for collecting disaster information rapidly, and others gathering community input on city planning. Now, in full transparency, when we were first coming together on this, we weren't tied to a specific geographical region or even in looking at a climate assessment. We were open to other priorities, conversations about earthquakes. It was all on the table. It was clear that we needed the voices of the community at the table to help us prioritize and focus our efforts. So we also recognized this was an opportunity for meaningful and equitable community co-creation, as Hillary brought up. So through existing partnerships and also recognizing that the incredible climate burdens that lay on the Duwamish Valley, we centered this assessment on climate health impacts in that area. We talk about those disproportionate impacts. So for those who may not be familiar, the Duwamish Valley includes the Seattle neighborhoods of Georgetown and South Park. And due to environmental and social injustices, this area, particularly South Park, which I don't know if the font might be a little bit hard to see up there, but South Park has significantly higher percentage of non-white residents and experiences significantly lower median life expectancy than other areas in Seattle. To make matters worse, many of the climate impacts, as Jeremy laid out, are expected to hit places like the Duwamish Valley harder than other parts of the region. Sea level rise, storm surges, heavier rains, they're all expected to exacerbate flooding in this area, which is already more frequent and severe than neighboring communities. And you see this image, this is from December 2022. We saw that type of flooding in this area, and this was right on the heels of our SASPR project. But we're not supposed to focus on the doom and gloom here. We're focusing on hope. I'm getting there. And that's what this is about. Like sea level rise projections, they've been on the horizon for quite some time before this unexpected event, and something that folks were collaborating on. Certainly something that members of the local community were already raising concerns about. And that's what the core of this project, our SASPR project, was, elevating community priorities and working together towards a more climate resilient future. So let's jump into it. Take a step before the flood. This was prior to that, right? We recognize with deep respect for the strengths and local knowledge that the community leaders had about climate vulnerability and resilience priorities. It was clear that the role of University of Washington or myself at a local health agency or other governmental agencies, we were better positioned at providing the evidence basis, the process, the support, and the infrastructure, creating the space for the communities and community partners to inform the purpose and value, right? In this way, that type of meaningful community engagement catalyzed this SASPR assessment process and shifted the discussion from centering climate change and resilience planning as a focus area. That was the community's priority. So we adapted this approach that I mentioned from the CDC, where you go door to door and you collect household data. And beyond shifting, thinking about climate resilience and future planning rather than a model that had typically been used for past disaster planning, we adapted this model also to center on environmental justice and equity principles, including most notably meaningful community engagement and co-creation. You hear that come up again. So what does that look like? This meant that community voices that were integral in determining the design of the survey, including equitable strategies around language access and what types of questions were included in the assessment to identify critical resources and support needed for climate resilience. The Duwamish Valley Youth Corps were trained by CDC experts who came here from Atlanta to lead survey teams, thereby building skills for the next generation of climate resilience leaders. We'll talk about that pathway. They worked directly with UW faculty, staff, members, students, and local public health reserve corps to capture input from their neighbors as they went door to door in this community assessment in 2022. We know that participatory community-centered research can help demonstrate the disproportionate impacts of climate change on vulnerable populations. This initiative was putting that into action, showing it, boots on the ground. So UW and partners actually evaluated the novel approach that we did, sharing it with others around the country who might be interested in taking a similar community and equity-centered approach to doing a climate needs assessment. CDC and other jurisdictions are already picking up on that feedback and doing climate needs assessments using this type of model. It's an example of how UW can lead the way and work on a larger scale or in other contexts. But this is really where the rubber hits the road. Where do we go from here? The SASPR project helped identify climate resilience priorities for the community, by the community, right? And it provided also the opportunity to collect stories about the lived experiences of community leaders through an innovative story map that I encourage everyone to explore. I should have put a QR code for this one. Seeing these powerful, we'll get it to you somehow. Seeing the powerful perspectives of these individuals pulls together the sense of community and geography that I've been talking about, the project and its findings, and their future visions for climate resilience. Data collected and collaborations are already informing next steps for an emerging community climate resilience priority, flooding. Community leaders in UW partners are drawing from this experience to address this pressing climate issue. And what's been incredibly powerful, I'll say, for me as a practitioner and now School of Public Health faculty member, is being part of this community's journey towards enhancing climate resilience. So happy to talk more about this SASPER project. Was really excited and honored to be part of it. Thanks.